morning. It's Monday, the 3rd of February 2025, and today I'm going to talk about hypertension. Again, it seems the previous video I did seemed to be very well received by most viewers, and I didn't say enough about hypertension. There's a lot, and I realize that long videos are not very popular, but here again I'm going to relate to another patient of mine that's been with me for over 15 years, and her story is that she's had severe hypertension. It was ranging from 190 to 200 over 140. She was admitted to hospital on several occasions. Now, she definitely did have hypertension. I think we need to make this point here. When you have your blood pressure consistently high or repeatedly high, then that should be treated as hypertension, more than 3 readings, different occasions. But the sad part, and this is what I want to talk about, is that none of the medications we could use on her worked with her, in the sense that they all had terrible side effects. And all the medications that we use for hypertension, and I've mentioned this before, every medication has a side effect. Doesn't affect everybody in the same way, but this particular patient, and there are those few patients where not one medication works with them properly without a side effect. She at times used to end up with swollen throats, had severe coughing, muscle weakness, almost would collapse, flushed in the face with eruptions all over her body, had to be admitted for an anaphylactic reaction. An anaphylactic reaction is a shock. But be that as it may, the thing that she also had, she was going through a lot of stress. Remember I said one of the major causes of hypertension is stress. And I'm not saying that you must not, we shouldn't be having stress. We cannot avoid stress. Stress is part of life, no matter how you look at it. What we need to learn to do is how to deal with stress. And I mean, anger and so on are part of the reactions, the way we deal with stress, which is incorrect. So we need to be calmed down. And I must teach a simple breathing exercise, and that is just to take deep breaths in and smile if you can, and slowly out, because what that does, it really calms you down, and get into the habit of practicing that. This particular lady had a problem son who was really on substances, giving her hell, and she was really traumatized, and that contributed significantly. When I saw her today, as both the children were doing well, the son was off his drugs, she was much calmer, she's not on any treatment, and the blood pressure, believe it or not, is 140 over 90, which is by all standards pretty normal. So you could see, if you deal with your stress, your stressful situation goes away, your blood pressure settles. How do we deal with these blood pressure? What are the other factors that we need to consider? And that is the high sugar intake. Sugar in whatever form, carbohydrates, it's an inflammatory effect it has on the blood vessels. When it causes inflammation, it burns the inside lining. What exactly happens is that it causes an irritation and causes a narrowing of those vessels. And the narrowing of that vessel will increase the blood pressure. So if you have a problem with hypertension, check and see that you don't have a sugar problem or insulin resistance. We've got to treat that. If you've got hypertension, cut out your carbs. It's not only about diabetes, it's also about hypertension and heart disease. So I hope you've learned from that. Amongst the other things I might need to tell you, fruits of all kinds are high in sugar, so try and avoid them. So anything that is sweet for the mouth is bad for the body. So minimize your sugar. Just eat meat and vegetables 2 meals a day, lose weight, and exercise, and de-stress by going out, doing things, going to movies, or going to the beach, taking a walk, exercise. These all contribute to lowering stress. Well, I hope this will help you to decide whether you've got hypertension, how to treat your hypertension without the drug intervention. Take care, and God bless. Dr. Repeating.